Hello dear students, today we are going to learn about the red cell inclusions. First is the basophilic stippling. Basophilic stippling refers to the presence of small blue purple granules which are dispersed throughout the cytoplasm of a red blood cell, which can be seen on Giemsa or Wright stain, and these granules represents the precipitated ribosomal RNA due to the defective degradation of these RNA, and these are typically seen in the conditions with defective hemoglobin synthesis or disturbed erythropoiesis. It is classically seen in lead poisoning due to the inhibition of pyrimidine 5-nucleotidase enzyme, and other causes include the arsenic poisoning, thalassemia, sideroblastic anemia, megaloblastic anemia, and alcoholism. These stippling can be fine or coarse. Fine stippling can be seen in thalassemia, sideroblastic anemia, megaloblastic anemia, and alcoholism. However, the coarse stippling is classical finding of the lead poisoning. Next is Howell-Jolly bodies. Howell-Jolly bodies are small, round, deeply basophilic nuclear remnants and are made up of DNA and seen within the red blood cells, and these can be stained with the Giemsa or Wright stain. These are located eccentrically and usually eaten up by the spleen. So any condition which is associated with functional or anatomical hyposplenism is associated with the presence of Howell-Jolly bodies in the peripheral blood smear. Common causes include post-splenectomy state, sickle cell disease due to the autosplenectomy, and severe hemolytic anemias. Occasionally, it can also be seen in megaloblastic anemia. Sickle cell disease is associated with the autosplenectomy. Due to the recurrent thrombotic events, the spleen size is reduced and shrunken spleen is seen in the sickle cell disease, and this is known as autosplenectomy. Detection of Howell-Jolly bodies thus is a useful marker of splenic dysfunction, and it aids in the identifying a patient at risk of infections with encapsulated organisms such as meningococcus, Haemophilus influenzae, and Streptococcus pneumoniae. Come to the next is Pappenheimer bodies. These are small, irregular, and iron-rich granules located eccentrically in the red blood cells. In cases of anemias associated with the iron overload like sideroblastic anemia, myelodysplastic syndrome, and thalassemia major. Pappenheimer bodies are usually stained with the Prussian blue stain, which is a stain for iron. Next is Hinge bodies. Hinge bodies are intracellular inclusions composed of denatured hemoglobin, and these are formed due to the oxidative damage to the red blood cells. They are not visible in the routine Giemsa or Wright stain, so it requires the supravital stain like the crystal violet and the brilliant crescent blue stain or new methylene blue stain. Conditions Associated with the Hinge bodies are G6PD deficiency, unstable hemoglobinopathies. These inclusions attach to the red cell membrane, making them less deformable and more prone to splenic removal, leading to the bite cell or blister cells seen in the peripheral blood smear. These are the bite cell in a case of G6PD deficiency. G6PD deficiency patients, because these Hinge bodies in this case are removed by the spleen. Next is Cabot ring. Cabot ring are thin thread-like red-violet ring or a ring with figure of 8 appearance seen inside the red blood cells in cases of vitamin B12 or folate deficiencies and in some cases of myelodysplastic syndrome and lead poisoning. They are the remnants of mitotic spindle. Now come to the other inclusions like Plasmodium falciparum infection. Plasmodium falciparum is typically seen as multiple delicate ring forms which are known as trophozoites within a single red blood cell, often with double chromatin dots. These are chromatin dot and this is actually these chromatin dots are blue in color and they are this is the trophozoite. So this structure usually appear as a headphone and there are multiple these structured in a single red blood cell. Some forms attaches at the periphery of the red blood cell. This is known as applique or form. Gametocytes are crescent shaped. This is characteristic of the P. falciparum infection. And these parasites do not have small pigmented drops which is seen in the P. vivax infection. Plasmodium vivax infection on peripheral blood smear is characterized by the enlarged red blood cells with amoeboid trophozoites. The amoeboid trophozoite with large it increases the size of red blood cells and the amoeboid shaped of trophozoite have irregular shapes with abundant cytoplasm. The infected red blood cells often show Schuffner dots and fine these Schuffner dots are fine eosinophilic stippling due to the alterations in the red cell membrane. Ring forms are usually single per red blood cells. So in this case here ring form is seen but it is single and as the parasite matures, developing schizones with 12 to 24 merozoites and round to oval gametocytes are commonly seen. This is this schizont stage. In this schizones, there are 12 to 24 merozoites, and here these are the gametocytes. Sometimes the eukaryote can be seen. Parasites like Babesia, which is transmitted with the exodus tick bite, and it's seen in the ring form or Maltese cross form. Ring form can be single or multiple in a single red blood cell, and it also do not have any pigment. There is no pigment, there is no liver stage or extra erythrocytic stage, no schizont, no gametocyte is seen in the peripheral smear, and sometimes these ring forms arrange in a group to form a cross like Maltese cross. This is known as Maltese cross appearance. Another thing is the nucleated red blood cells. These are the nucleated red blood cells commonly seen in the bone marrow, but if it is present in the peripheral blood smear, it is usually associated with the stress marrow response due to the severe hemolytic anemia, hemoglobinopathies, chronic myeloid leukemia, myelofibrosis, myelophthisis, and in neonates it can be seen physiologically. Myelophthisis means the infiltration of the bone marrow by any malignant neoplasm which causes the release of these nucleated red blood cells in the peripheral blood smear. So this is all for today. Thank you.